a small introduction. And to give a small context to this session, when we talk about smart cities, we have to look at the health here as a big issue. So we have a very striking example here from Dr. Borah. He has implemented a low cost and quality oriented health care in Assam, which may be an example that how health care as an issue has to be looked at when we are thinking about smart cities. And we always like to think of IT, we should think about roads, we think about the buildings when we think of smart cities. But how important is health? How important is emergency services? How important is care for poor when we think about smart cities? So this is the context why we have a special address by Dr. Borah, who is the founder of the biggest health care chain in Assam, and how he has implemented affordable health solutions for the poor in the state of Assam. So it's an honor that we have with him with us at this event. I invite him to address this audience here. Welcome, sir. Give me a big hand.
Thank you, Mr. Gupta, for your kind and generous introduction. When I got the invitation from Mr. Gupta to deliver his speech in this August forum, I was pleasantly surprised and at the same time little confused. Because till that time I had no idea, no knowledge or information about smart cities in India. I met him yesterday personally just to understand what these smart cities are and what I am supposed to do there as a doctor. I am a medical doctor like Dr. Ratnaji. We treat patients, give them quality care. Try to happen. We are always grounded. So we are always with life. Once it slips out of your hand, it slips forever. So we are very, very serious people that way. Anyway, but till this morning, I had a lot of uncertainty in my mind. But while coming to this hall and while listening to my previous speakers, I could get some ideas about the future smart cities of India. In India, it will be mostly brownfield projects. It will be inclusive. It's for people, not for technology. Technology would be utilized as an enabler to improve the quality of the life of the citizens of smart cities. And more importantly for a doctor, irrespective of caste and creed, race and religion, socioeconomic status, these smart cities will be inclusive. My concern is, if these smart cities do not become inclusive, we are a country based on the principles of democracy. Each and every opportunity must be percolated to the last person in the society. If we are not able to plan it that way, today may not have any problem. Tomorrow, then the difference in equitable distribution of opportunities and world will create chaos, confusion, and social turmoil. Therefore, we must do whatever we are planning to do, where everybody is included in the concept of smart city. If that is so, then healthcare and the GNRC model of healthcare has a relevance in this discussion. I will be a little more selfish in next couple of minutes because I am compelled to mention about GNRC model of healthcare because I had no other alternative. For last 2 decades, 3 presidents of America, in their 6 terms, were struggling to find out solutions to affordable healthcare to the citizens of America. They are a very rich country. Healthcare is still a problem of affordability, problem of quality, and problem of accessibility. In India, the problem is much more bigger. You have on one hand the private sector hospital, which are terribly expensive. 80% of the people cannot go there just because they cannot afford it. On the other hand, the public hospitals are overburdened by number of patients. They are not able to manage. They are crumbling and about to collapse in spite of best possible efforts. Doctors are overburdened, nurses are overburdened, everybody, resources are scarce. How much is it? Where is the solution? There was no immediate answer. We were managing 2 hospitals in northeast region of India. Those started immediately. I became a neurologist after my training in Holiday Institute of Medical Science. I was an anguished person. I did not have satisfaction in my work. I created 2 hospitals. They are economically fine. Those are the destination point for the patients of Northeast region. But I could realize that I am available to and affordable to only a small section of the people in the society. As a doctor, it does not give me satisfaction. I, as a doctor, would like to make myself available to whoever is sick, because it is life. Every life is precious. But the 2 hospitals that we were running did not provide a solution to that. All the other private hospitals in this country are like that. We have created state-of-the-art hospital with state-of-the-art technology, and we are looking for America and other European countries for patients. Whereas 80% of the people do not have accessible healthcare, affordable healthcare. This can be a good, wonderful business model, but this cannot be an answer to the solution to the healthcare problem of the millions of people in this country. There was no answer for me. We decided to go back to the community. We decided to go back to the community and try to find an answer from them. Answer is not there where I studied. Answer is not there what we did during last 25 years. There is no answer in Washington. There is no answer to this problem in New Delhi. It may be a community who has the real problem. They might give me an answer to this problem. Now, what this model is created? We created a model where, if you look at the cost, all accident and emergency patients are treated free for first 24 hours. Rich or poor, wealthy or unwealthy, they have access to emergency care for first 24 hours. They don't have to pay any money for the treatment. Blood test, X-ray, CT scan, everything, including medicine, surgery, everything is free. Everything is free. We treat 80% of the patients in their doorstep because I don't want them to come to the hospital. It's a 1 day's loss. They lose their 1 day's time. We created a hospital on quick, fitted them with common medical equipment, an X-ray, ECG, ultrasound, PET smear testing facilities. We go to the place, find out who has got what problem, and we found out that 80% of the problem can be solved there, then and there. 20% of the problem which could not be solved there needed to come to a hospital, either for further diagnostic test or for surgery. We analyze what their problems are. What equipment should be needed to diagnose them? What kind of doctor will be needed to treat them? What kind of operation theatre should be needed to treat them? And what are the common medical emergencies that is being created in a community which needs to be managed without any loss of time? Accordingly, a hospital was designed, a project was implemented. Money was borrowed from bank. Bank told us that you have to complete this project with an investment of 35 lakhs per bed. Any super specialty tertiary care hospital is can be created by investing 50 lakhs to 100 lakhs per bed. We were given 35 lakhs. We involved the local community in the construction work. So lots of resources went into the community which made them happy and improved the living conditions of the community. Most of the locally available resources are deployed. Not only that, we also even created skill to make beds for ourselves, the wheelchairs, lockers and all. We did not buy it from the market. These are very robust. We saved a lot of money. So investment per bed came down from 35 lakhs to 25 lakhs. Not only that, this project, it's a greenfield project, was supposed to be completed in 2.5 years' time. We completed it 9 months ahead of schedule. We completed it 9 months ahead of schedule. Then while coming to the charging the patient, these are bank's money, we must return it. We must be self-sustaining. But the prices of the hospital was designed and decided based on what the community, my patients can afford to pay, not based on what the market rate is. And accordingly, we realized that accident and emergency, most of the time they don't have money. We don't charge them. For small little common medical problem, they don't need to come to the hospital. We give you services at your doorstep. These are extended services to the community from the hospital. Much emphasis was laid on preventing diseases and promoting positive health. We did not want them to fall sick, come to a hospital, increase our business. That was not our motto. We wanted to promote their health and prevent their diseases. And while in hospital, the rates of these people, services for these people were abysmally low. For example, a surgeon or a physician or a pediatrician would charge on an average 300 rupees in that part of the country for a consultation. We charge only 60 rupees. For a neurologist, cardiologist or gastroenterologist, we charge on an average of 750 rupees. For a consultation, we fixed it at 120 rupees. The CT scan was 900 rupees, MRI was 2,500 rupees. Many of these services are much lower than the public hospitals. But the inspiring story is that even after doing this hospital promises to be much more profitable than so-called private corporate hospital. Private corporate hospital. So now we have a model. It has drawn the attention of the international community. World Bank noticed it. They encouraged us by giving a development marketplace award, and their intention was that you scale it up, make it available to similar parts of the country in India, Bangladesh, Myanmar and Africa. They would be most immensely benefited. It came to the notice of Bill Gates. He tweeted, great approach. A simple business plan is helping health services reach more of India's poor. So, I'm not telling it that we have done it, but people feel that probably we are finding an answer to the problem. Another article which was published internationally, it has written, unique frugal healthcare delivery model set to expand in India. A newly set up hospital in the northeastern Indian state of Assam has cracked the access and pricing barrier. I think cost is very, very important. Accessibility, affordability. And the third factor is the empathy through which you treat patient. Ratnaji will understand what the empathy is. We keep talking about technology in healthcare, it's needed. But we must all remember that health is a state of physical, mental and social well-being, not merely the absence of disease or infirmity. That's the definition of World Health Organization. When I come to you as a patient, not only I have a body, I also have a mind. Unless a doctor knows how to take care of the mind, even if he gives you the best of the medicine, you don't get cured. Otherwise, by this time, doctor like me or Ratnaji would have been replaced by all these computers and robots. It's not possible. You cannot take away the mind from the body of the person. Then you become a robot. So, technology should be used in medical science only as an enabler, but not as a replacement of the doctor. Doctor is needed to heal you. He gives you the healing task. That is not only medicine, not only sophisticated gadgets, it's a healing task which makes you qualified. So, that's what Mother Teresa, when she visited us, she commented that we are one group who tries to treat patients with empathy. Empathy means I must feel what my patient and their family is passing through. It should be reflected in my approach to the patient, in my verbal and body language. The doctor who can do that, he can win the trust of the patient. One of the speakers, Professor Jagat Shah, was mentioned that there should be zero loss of life and there should be trust. So, trust is very important in this profession, and GNRC Medical stands for all the values that I was talking to. I think a smart city is for people. Health is more important than any other wealth. In fact, health is the greatest wealth of humanity. And if you are sick, you can't do anything. You cannot imagine that you'll be sitting here. You'll be imagining about, planning about smart city. So health is more first. So every smart city must also be a healthy city. And in every healthy smart city must have a healthcare model which is accessible, which is affordable, and where patients are treated with empathy. Only then the smart city citizens should be happy and the project to be successful. So, with these two words, I would not like to take much time. I am thankful to Mr. Gupta for giving me this opportunity to present my thoughts and share my feelings with you. Thank you very much.
Are there any quick questions to Dr. Borah? I think his presentation was completely itself. I thank him for being here, and I will, on behalf of elets, like to present a speaker memento to him. And with this, we will start with our next session, which is